Hello, and welcome to It All Adds Up, Toxic Chemicals and the Future of Women's Health. I'm Kizzy Charles Guzman, the CEO at the Center for Environmental Health. How many of the women in our lives are fighting preventable diseases, breast cancer, infertility, reproductive health issues, or chronic health conditions? What are the cumulative effects of toxic chemicals in our air, water, soil, food, and the products that we use every day? And how does our makeup, clothing, and skincare affect our health? Today's town hall brings together experts to illuminate these questions. We will learn about the health effects of cosmetics on women, the toxic chemicals lurking in our athletic clothing, purses, footwear, and yoga mats, how pollution impacts our bodies and communities, and the policy issues we must push forward for systemic change. This discussion could not be more timely. Did you know that the National Academies of Sciences, Engineering, and Medicine report that 98% of people living in the United States have PFAS chemicals in their blood? Also, studies looking at a representative cross-section of the United States population showed that over 90% of people have parabens in their bodies. Higher concentrations were found in women, people in high-income households, and African Americans. Now, how did we get to a point where almost everyone is carrying toxic chemicals in their bodies unknowingly? It is not just an individual problem, it is systemic. Women, in particular women of color, bear a heavier burden because of how and where we live, the products marketed to us, and the healthcare we receive. Endocrine disrupting chemicals like BPA and parabens can still be found in our products. CEH's own research found high levels of BPA in socks, sports bras, and athletic shirts. In fact, it was up to 22 times the safe limit of BPA according to California law. BPA is known to cause reproductive harm and can be absorbed through our skin. BPA exposure is also linked to the development of breast cancer. Recently, Consumer Reports investigated synthetic braiding hair, a product widely used by millions of Black women and girls in the United States. They found dangerous chemicals in every product that they tested, including carcinogens and lead. And this is happening while research shows that PFAS have been found in water systems serving up to 25 million Californians. Importantly, PFAS pollution continues to be more prevalent in state-identified disadvantaged communities, with almost 9 million Californians in these communities potentially impacted. All that to say, the avenues for exposure are pervasive and seem relentless. This is why today we're lucky to have 3 experts to learn from. Let's begin with a recorded conversation with Ami Sota from Columbia University's Mailman School of Public Health. Dr. Sota was among the first to frame the disproportionate burden of toxic chemical exposures from beauty and personal care products among women of color as an environmental justice concern. After that, we'll be in live conversation with Janette Robinson Flint. She's the Executive Director of Black Women for Wellness, and also with Shakur Azimi Gaylon, the Senior Director of Toxic Exposures and Pollution Prevention here at the Center for Environmental Health. Get your questions ready, that's your homework, and use the Q&A feature at the bottom to ask your questions. So let's get started. Cue the video. My name is Kizzy Charles Guzman, and I'm the Chief Executive Officer of the Center for Environmental Health. And today I am really happy and proud to be speaking with Ami Sota, the Associate Professor of Environmental Health Sciences at Columbia University's Mailman School of Public Health. Ami is a population health scientist with expertise in environmental health, environmental justice, and maternal and reproductive health. Dr. Souza was among the very first to frame the disproportionate burden of toxic chemical exposures from beauty and personal care products among women of color as an environmental justice concern. Welcome, Amit. Thank you so much for making time to be with us today. So I would just love to jump right in, and if you could just maybe tell us by way of introduction, how did you decide to research the effects of makeup and skincare on our health? And what would most people be surprised to know about?
It's really lovely to be here in conversation with you, Kizzy. And thank you for, kind of opening it up with that question. So from I guess early years, I was always interested in how science could be used as a tool for social change. And it took me a long time to find sort of how I could work at that confluence. I had a wonderful mentor in undergrad who introduced me to environmental justice. And then I decided to pursue a master's and PhD in environmental health sciences, where I started doing community-based participatory research on a range of issues, including looking at asthma triggers in public housing and understanding the health impacts of mine waste on indigenous communities in rural Oklahoma. And then when I graduated, I started working on this project at the Silent Spring Institute on linking breast cancer with environmental justice. And I became introduced to the field of endocrine disruptors and how prevalent they are in consumer products. Um, but I found that some of that work was really missing an equity lens. And I also, the more I learned about consumer products, I started thinking a lot about personal care products like cosmetics, skincare, menstrual and intimate care products. And so I just sort of, both pursued my curiosity as well as tried to address gaps in the science.
Amazing. That is an incredible link. And we know that your research is really focused on understanding those social and structural determinants of environmental exposures and their consequences. I think that we all have a loved one, a woman in our lives that has a health outcome that we can link to an environmental exposure and to these personal care products and the toxics that are present in them. Um, you have spoken about this framework, the environmental injustice of beauty for women of color. Can you tell us how you define this concept more specifically?
Sure. I would say this framework is really motivated in, sort of two pillars. One is that if you look at the health of women of color and, for example, Black women in particular, they have higher rates of many health conditions, many of which have a hormonal component, whether it's, higher breast cancer mortality, higher prevalence of uterine fibroids, which is a condition that I study, as well as more severe fibroids, more asthma, more pregnancy complications, greater maternal mortality. So I think, one, there are these kind of really longstanding, troublesome inequities in health outcomes. And I think that, there is an important environmental component. So, that's one piece of it. But the other really piece is, in my work and that of others, we started seeing that women of color have higher levels of certain beauty product related chemicals in their bodies, like phthalates and parabens. And we also started seeing that these same women were more likely to use more toxic products, whether that was hair relaxers or skin lighteners containing mercury or fragranced products, especially fragranced intimate care products like douches. But what was missing was sort of the social context around why certain populations may use certain products, right? Because often we think about what, kind of how you choose to show up in the world and the products you use as an individual choice.
That's right.
But that individual choice, it occurs in a context, right? It's not occurring in a vacuum. It occurs in a social context. And that social context is really important and powerful, right? And so we know that beauty one of the oldest forms of power. It's a very gendered form of power.
That's right.
And that our what we consider beautiful is really shaped by social and structural factors, whether that's white supremacy, colonialism, racism, sexism, classism, and that these things interact.
Right.
And they lead to a hierarchy of beauty norms, where often Eurocentric beauty norms grounded in white femininity are at the top of that pyramid.
That's
And
right.
simply put, the closer you are to that top of the pyramid, the more social and economic benefits you have. So in certain countries, if you have light skin, you have greater likelihood of ending up in a good marriage, right? Or
Mhm.
if you have straight hair, you have a greater chance of getting a certain job. Um, so, so basically then, I think often women of color are sort of inherently outside of the preferred beauty norms. And so, and then there's also targeted marketing that's happening, that sort of plays on these dynamics. And so, kind of using more toxic products can be an adaptive response, right? And so all of this has, well, there's mental health impacts of all of this. But then there's also physical health impacts from the chemicals, right? So then there's sort of this can play out, across, starting as young as childhood, all the way, kind of through the journey of life. And, there can be serious health, consequences to your health and well-being.
Absolutely. Gosh. And to me, this is what's so critical about the work that you're doing, that you're really taking this social context and this environmental context, right? There are the products that are marketed to us, there's where we live. Like the reality of our exposure is more than I went to the store and I chose to buy this product that I knew was toxic and then I put it in my body, right? So I think that that is really insightful and it's critically needed to be documented. Um, that said, I think we all are constantly wondering, even as we live within the systemic, oppressive system of these Eurocentric beauty norms, what are things that we can do, some practical steps that we can do to reduce our exposure, even within that context? What do you think what are the things that you feel like we have some choice about?
Sure. I mean, I think I would like think about like two or three things. One is that there are, times where we
Mhm.
may be more vulnerable to the negative effects of these chemicals in these products. So pregnancy is one such time, right? So what you get exposed to during pregnancy can not only affect, like your delivery, your kind of health during pregnancy, it can have impacts on your child. So that's a window where maybe you want to limit exposure. Also, childhood, especially before puberty, is a really
Mhm.
another critical window of exposure. So really think twice, especially about the messages you send around beauty to the young people in your lives, as well as the products that you're using on them, during those times. I think another thing is to avoid fragranced products, where possible. I mean, it is kind of insidious and in everything, but
Mhm.
it's not functionally necessary. So, and then I think the another thing we can all do is just have conversations about beauty norms, among our peer circle, with our family and friends. And, I think we should all, you know, in the context that we're comfortable with, push back, and whether that's like pushing back in terms of how we decide to show up in the world, or just, pushing back when you hear people sort of make, comments or conclusions about sort of, giving preference to these racialized beauty norms, whether it's around how someone smells, or, commenting on their dark skin, or, so forth.
That's so critical. I love this concept of pushing back, and I always, especially here at the Center for Environmental Health, believe that even if there are things that individuals can do, ultimately, it the onus is on our government to protect us, right? And to ensure that these personal care products don't have these toxic chemicals in them to begin with, right? So this pushback is also going not just culturally, but also up. So this is a good transition. I know that what we are all working towards ultimately is transitioning away from fossil fuels, because we know that that is critical to both planetary health, but public health also. We need to reduce that kind of production and therefore the consumption of these toxic chemicals. Can you talk a little bit about what policy efforts you see as critically necessary so that we can achieve safer personal care products?
I think that's a great question. And going back to the structural drivers of this problem of why we have to worry about chemical exposures in cosmetics and personal care products impacting women's health, so there's the sort of structural problem around beauty norms, but the other structural problem is that this entire industry is severely underregulated,
Yes.
right? And so, so that we are all having to carry the burden of trying to make safer choices and because the government isn't adequately protecting us. And so I think that's an important truth. And ideally, we need federal policy reform, but that's pretty hard to come by, and may be harder in during our current times. But lots of great work is happening at the state level, and so I've testified using my science and the science of others and to help provide critical testimony, both in California and Washington State, which have both passed cosmetic reform bills, and New York is also now considering similar legislation. So I think there is hope at the state level.
That's amazing. And absolutely true. And this is an area where we all can also help to advocate, right, as individual consumers, because these are our elected officials that have our health in their hands. Let's leave our audience on a positive note here to wind down. What's one word or phrase that we can all take into the future?
So I know it's a really tough time right now, and so much of the work we do and the things we believe in are being threatened. And so I think just the practice of radical hope in and of itself is a form of important resistance. So I think it's important to find hope in the big and small ways. I know for me personally, I work with a lot of young people. I spend a lot, I'm very committed to training the next generation. And so, for me, that they give me hope.
Yeah, well, thank you, Ami. Like, certainly, I think another positive note I want to leave us on is just gratitude. We really have to um, center our gratitude, and I want to express my gratitude for you and the work that you've done and the way that you take your work in the public interest, right? Like, there are many people that research important topics and they publish important papers, and 15 people in the world can read that research, including their moms. But in this case, you're just so thoughtful about not just your career path, but also training that next generation of leaders, and then making your research very actionable and doing the testimonies and supporting the campaign. So gratitude for you and the work that you do. Thank you. Have a lovely rest of your day. And I really appreciate you joining us today.
And I just want to say gratitude to you and the Center for Environmental Health for all the important work that you're doing in this space too.
Of course. Thank you so much. That is so invigorating. Thank you again to Ami Sota for that powerful, powerful opening. And now let's hear from Shakura Azimi Gaylon. I will let her say a few words. And Shakura, building off of what we learned from Ami, what harmful chemicals are in our personal care products, and what is the Center for Environmental Health doing about it?
Thank you, Kizzy. Ami's conversation on the holistic look at how beauty intersects with environmental justice is a really important point. A widespread exposures of toxic chemical and the public health impact of these harmful chemicals have been underestimated, since most research and regulatory approaches currently focus on effect of individual chemical. The problem with this approach has resulted in a significant health impact on the communities, because even the individual chemical standard may not be violated in an area, but when there are multiple sources of individual pollutant in a concentrated area, then the regulation fails to protect these communities. In reality, communities are exposed to complex mixture of chemical from multiple sources, not just single chemical or single pollution. So a shift toward addressing chemical classes rather than individual compound is needed for better risk assessment and better regulation. Another key point from earlier conversation is that women have higher risk from toxic chemical in consumer product that everyone uses. So the biological factor like hormone fluctuation, pregnancy, and breastfeeding make women more susceptible to the effect of these chemicals, particularly endocrine disruptor, because they interfere with our hormone in our body. So additionally, when cosmetic and menstrual product primarily used by women containing harmful chemical, that further aggregate exposure of toxic chemical in women. So all of these chemical and all these ingredients in cosmetic do not require FDA's approval before they come to the market. Therefore, manufacturer and retailer who market should take more responsibility, but they're of course under-regulated, and they don't meet their legal responsibility to ensure the safety of these products. So due to the lack of regulation and absence of guideline to evaluate these chemicals by government, consumers frequently navigate a complex landscape of product that may carry a known risk. CH is leveraging existing laws and policy to protect women's health from toxic chemical. For example, California Proposition 65 law has provided a powerful incentive for businesses operating in California to reduce and remove chemical from product. Under Proposition 65, CH has taken legal action to remove or reduce chemical and cosmetic and personal care product. Just as a few examples, CH has reached a legally binding agreement with Estee Lauder and its subsidiaries, including MAC and Clinique brand, to ensure their cosmetic like foundation and concealers will not contain any intentionally added PFOA or other fluorinated ingredient or harmful PFAS chemical that are also called forever chemical, and they have been linked to different cancer and adverse health effects. Last year, so CH also last year sent notice of violation to companies and retailers because our testing showed that 1,4-dioxane were present in shampoo, body wash, and hand soap. For all these actions, CH worked with manufacturers to reformulate their product or adjust their manufacturing processes in order to eliminate toxic chemical that would otherwise require a reasonable warning for these products if they are sold in the future without any reformulation. CH also is leading and supporting policy action to protect women's health. For example, CH worked with allies and supported Assembly Bill 2515 that banned PFAS in menstrual product last year. And CH advocated for toxic-free medical devices that ban the manufacture, sale, and use of DEHP in IV bag and tubing in California. DEHP is a chemical that belongs to family of phthalates and has been linked to breast, liver, and lung cancer. Exposure to this chemical during pregnancy may lead to preterm birth and delayed mental development in the child. CH currently is advocating for Assembly Bill 60 that will restrict the presence of synthetic nitromass compound in cosmetic and personal care products. These compounds are commonly used in a variety of cosmetic and personal care products, including soap, perfume, shampoo, and deodorant. These compounds have been heavily banned and restricted by European Union over the last decade. So it's time for California to catch up, and hopefully this also will be adopted by other states.
Yeah.
Thank you, Kizzy.
Of course. My gosh, I have to say, this message you shared about women having to navigate the complex landscape of products so resonates with me, because as if women didn't have enough to do already. Too many things in our plate. What we don't want to be doing is literally standing at a store, you know, like looking at the back of a product, trying to figure out if there's PFAS or BPA or phthalates or any other endocrine disrupting chemical in it. It's unconscionable that we as consumers have to endure this. But also, Shakura, I just want to express my appreciation. Because the team does so much important work, both on the policy and the testing side. The entire team just works tirelessly to ensure that you know, these products are safer for us. So I'm lucky to get to work with you every single day. So thank you for that, and for your leadership. And of course, I'd be remiss if I don't include my friend Janette Robinson Flint into the conversation. Again, she's the Executive Director of Black Women for Wellness. I would love for you to share a bit more about your reflections and your work in this space. How is this an environmental injustice issue for women of color in particular? What are you seeing in the communities?
Oh my gosh. Thank you, Kizzy, for inviting me to this conversation and to this topic. It all adds up. And I absolutely agree that it all adds up. One of the things that we have talked about at Black Women for Wellness is the number of chemicals we use every day and how each day it adds up. So if you go to the next slide. I'm going to tell you a little bit about Black Women for Wellness. Our offices are in Los Angeles and in Stockton, so we're very much a California organization, and California seems to be able to create a lot of movement around beauty justice. So the programs that we are doing at Black Women for Wellness now includes a research project, Taking Stock, where we're actually measuring the amount of chemicals that are in women's bodies. So our community has been a key and major part of this work. Doing biometric measuring of body fluids, etc. And this has been ongoing now for 5 years. Because guess what? Black women noticed that we were getting aggressive forms of cancer. We noticed about uterine fibroids, and we also noticed about maternal and infant mortality. We are also in partnership with UCLA, EPA, and California Healthy Nail Salon Collaborative. This work has been ongoing since at least 2009, when we did a survey of the beauty institutions in our community, the nail salons, the beauty salons, the wig shops, etc., and began to ask that community of folks, so how you living? How's your health? And because what we say, and we still say it, is that that profession is overexposed and underprotected from harsh chemicals, right? If your hairstylist does your hair, they're doing more than one person's hair every day. If your nail technician is doing nails, they are doing more than one person a day. So that's the overexposure. And the underprotection is one of the first things we came up with was we worked with an industrial scientist to talk about how do you lay out your shops to reduce your exposure? What do you need in terms of personal protection gear? So that came before COVID, when we talked about using masks and goggles and aprons, where to position your fans, that type of thing. So that is part of the study that we're doing with California Healthy Nail Salon Collaborative, UCLA, and the Environmental Protection. Curls and Conversations. We would be remiss as a community-based organization if we did not report back, report in, and check in with our community. So this is where we have conversations with our community on a regular basis about how to reduce risk, what advocacy needs to be done, what federal agencies need to be and state agencies need to be held accountable for our overexposure. Our Beauty Justice Conference is coming up on April 21st, as this month. And we actually started that with doing a hairstylist appreciation day. If we go back to some of the stuff, the points that Ami made, and some of the points even that Shakura made, that we are forced to live up to unrealistic beauty standards in this country. And it's not only Black women and other women of color, but we're all forced to live up to those unhealthy beauty standards. And it is our beauty professional field that helps us negotiate that terrain in that regard. On the other side, we just have the programs that Black Women for Wellness is doing, and we can go to the next slide. So we want to talk about some of the harmful products that are found in the harmful chemicals that are found in our everyday products. So when we first entered this field, we used to ask people to do a purse check. What's in your purse? Most people thought there are no chemicals in our purse. What are you talking about? We didn't think about the lipstick, the lotion, all the things that we just carry in our purse that are chemicals. So we're talking about also the average person uses at least 12 products a day. When we wake up, we do toothpaste. Yes, those are chemicals. We talk about body bath gel, we talk about moisturizer and all those things that they add up. And so as we go through the day, we add more chemicals to our body, and that how it adds up in that way. But guess what? These are daily routines, right? So it adds up in that way also. So that's why I love the title, It All Adds Up, because we're looking at over long term. If we start, and this is insidious, and if we start with our daughters when they go to preschool or school doing their hair, so we're looking at 4 or 5 years old up until going through college or higher education, getting a job, right, up until we retire. And still those of us who retire still are keeping up our looks, right? So we're talking women adding chemicals to our bodies over decades. And what we also know when it comes to breast cancer, Black women are more likely to get it at a younger age. Maybe we start younger in terms of trying to fit in. With the endocrine disruptor chemicals, I believe, 80% of Black women have uterine fibroid tumors. And this is what we think is some of the connection to it. What we also found at Black Women for Wellness is as we were asking these questions, there were very few people, very few researchers attempting to answer these questions, to make the connections, to see if there's correlations. That's one reason why we said, well, we need to answer these questions ourselves. If we think about just recently, that consumer report came out where 100% of tested samples contain toxins, and there are so many Black women who have all type of product in our hair, but now it is just another added factor when we were trying to do protective hairstyles, that some of those protective hairstyles now are even toxic also. So it does all add up. There is a disproportionate exposure of harmful chemicals to Black women, not only because of the number of chemicals that we use, because the chemicals that are marketed for us or prepared for us are much more toxic. We can go to the next slide. So Ami already brought this up into this Eurocentric beauty standard that we are forced to live up to. And I say force because it has impact on our financial health. It has impact on our social status. It has impact on our physical health also. So, and then those, if you get hired, if you get accepted in school, how many places ask you now to send a photo of yourself on your application, or they go and check your social media now to see what you look like, how you present. And yes, they choose people who, quote, present well. So it's an insidious thing. Some of the things I have here, for example, which kind of like demonstrates the point, is the Crown Act, which we passed in California, that said it is okay to wear your hair natural to work, that you can't be discriminated against. We had that passed the law in 2000 because women who wore their hair natural were still not getting the job and were still facing discrimination at work. Let's go to the next slide. I'm trying to be fast here because I know time is a factor. So practical steps to reduce exposure to harmful chemicals. Well, let me say this. The QR code there leads to a flyer. It has 14 ways to reduce your exposure. But let me also say on the back of that flyer, this is not your fault. We have totally not held accountable the industries that should be protecting and regulating the harmful toxic chemicals in products. We have not held the FDA accountable, and in actuality, they have minimal power to do that. So we have not even increased their power to regulate industry. We have not held EPA accountable. And we have not looked at the societal norms that sometimes we unconsciously impact or make happen, or the way we treat other folks if they don't look like us. Right. So some of the things you could do, read the label, but I also believe, and this has happened to me, I have went shopping with a chemist. It was hard shopping with the chemist because she knew what all those chemicals were. So we don't want you to have to be a chemist to go shopping. But nevertheless, you should read the labels, right? You should look for labels with a lot of no parabens, no sulfates. That is helpful, right? And that's part of choosing simpler formulas. There's another thing you could do. You can make ingredients yourself. A lot of us think we don't have time to do that. But if you make it yourself, you know exactly what's in it. There are a lot of apps now that you can, when you go shopping, you can run that label, or you can scan that app, scan the label into the app, and it'll tell you if it's good, okay, or horrible. You can shop small businesses, right? You can try a natural style. That's risky. We know that, especially if one is, quote, professionally employed. But you could try a natural style. Or you can have longer between when you expose yourself. So instead of getting your hair and nails done every week, you can go to every 2 weeks, perhaps 3 weeks, perhaps a monthly thing. And that way it reduces your exposure because you're not doing it as much and as often where it has that chance to add up. But like I said, you can absolutely go to the QR code, and it gives 14 ways. It talks about opening a window when you are using products. So some of that window that air can circulate out as opposed to concentrate in your space. It talks about using personal protective gear when you're doing your work too. Next slide. So these are some of the things that are going on. California, New York, and Washington are leading, requiring transparency on products label. In our work with Silent Spring, what we also found is that a lot of the ingredients that are in products are not listed on the label. So that's why we are trying to increase that transparency. And then banning some of those. One of the things I think Shakura mentioned is that in Europe, they have different standards, they have different rules, they have different criteria. And if a major cosmetic company, and we're talking these cosmetic companies are like 8-9 billion annual companies, if they can do a different formula in European markets, then they could do a different that same safer formula here in American markets and not dump those toxic chemicals in African, South American, and Asian markets, because we don't want to make something better for those of us who live in the United States to the detriment of those of us who live in other places like Africa or South America or Central or Asia. Next slide, please. So there is a growing movement for social justice. There is a growing beauty justice industry taking place. When we first started this back in 2000, not so many people were interested. Not so many people wore natural styles. Not so many people would look for toxic-free cosmetics or toxic-free salons and that type of thing. So we're making progress. So that one word to take into the future is action. Right? And the action doesn't always have to be your action, but we can insist upon our governmental agencies taking action also. We can also keep ourselves informed, right? And stay in touch with Black Women for Wellness, because when there are articles that come out with Consumer Reports, or when Columbia or Silent Spring or even us publish articles, you can have a town hall, a community conversation with us, because we will make sure you understand it and how it impacts our lives and what we can do about it.
My goodness, thank you so much for sharing that information, Janette. A couple of reflections, and then I want to include Shakura here to jump in. Couple things. Number one, okay, audience. Okay, I see your emojis, I see your reactions, and it is just so clear that this was needed, and that our timing also, it is the ending of Women's History Month, is also a reason why we wanted to have this conversation. The bottom line is that these issues should be thought about, and it should always be Women's History Month the rest of the year as well. So I do want to set you up for starting today, starting tomorrow, starting the day after, to really think about these issues and how systemic they are, but also what we can do as individuals on the day-to-day to demand safer products. Thank you, Jenna, for mentioning the EU. The truth of the matter is that if the product is good enough to be sold in Europe, it should be also safe and healthy and good enough to be sold to Americans. And it is certainly our onus, right, to encourage and to demand that protection and that safety of our chemicals and our personal care products. I also want to just connect that. Normally, when we do this kind of presentation live, I tend to ask the audience, right? Like, how many of you have women in your lives that are struggling with one of these health conditions, including the fibroids, as you mentioned, Janette? And it's always just maddening to see how many hands are raised, which it is so sad, and it costs us dearly, right? Our health, our finances, our mental capacity, our communities, our movement, certainly, right? But it also fortifies us and organizations like ours to continue to show up and to continue to do the work every day. So I am asking this audience that I can't see, and therefore I can't ask you to raise your hands on this question, that for those women in your lives, help to spread the word and to demand safer products. Lastly, I want to ask Shakura to join us and to just share, what are policy efforts that we need to achieve safer personal care products? Are there any other practical steps that you think individuals ought to take to reduce our exposure to toxic chemicals in personal care products that have already been mentioned?
Great question. Thank you, Kizzy. So finding ways to solve environmental issue will require new science and new ways of thinking, like basic research to map out the issue and really find solution. Also, public advocacy, as Janette mentioned, to drive structure changes needed to put these solutions into practice. At the federal level, new policies are needed to take important public health steps, such as imposing mandatory and timely recall on these harmful beauty products.
Thank you for that. Sorry. And Shakura, just since Janette already shared her one word, can you please share our one word that we want to leave the audience with before we go to their questions?
Sure. So as our other two panelists mentioned, it's a challenging time, and we have to get up every morning with determination and have the courage and commitment to take a step forward, even when it's uncomfortable and predictable. So my words are commitment and determination.
Yeah. Oh, thank you for that. I really appreciate it. You know, in that conversation with Ami, I had shared that my word was gratitude. I just, after this conversation with us, I just want to say the word is also love. It's really clear that each of us gets up every morning and comes to do this work out of love for humanity, love for our bodies, love for each other, love for our communities. So again, just my deepest gratitude and love to Shakura for leading our teams at CH so ably. And of course to Janette for leading the charge also, and to Ami for leading this work academically as well. So all of these components are important: the advocacy, the testing, the policy advocacy, and of course the research. So thank you all. Let's take some questions. Oh, go ahead, Janette.
Add one thing, just to talk about the cultural shift that is normed, needed. Because if we have cultural norms, right, if we create great products, right, but we still have that bias against natural hair or that bias against how bodies normally or naturally look and smell, right? Then it is often not that we have, you know, great laws or we have great research in terms of the products. We have to do the cultural shift at the same time that we do the academic research, that we do the product development, that we entice, encourage, and push for the advocacy. So that's, I just want to say, let's make sure we add that cultural shift because that part is important. Awesome.
Absolutely, absolutely. You know, as you had mentioned, the thing about it adding up everywhere, this is a big piece of it, that the culture shift also ultimately is about consumerism and plastics, right? And how is it that we make those choices, and how is it that every little choice we make is adding up to something? So thank you for bringing that up. We had a good question come in from our followers on Instagram. Thank you for that. How does plastic packaging play a role in exposing women to more toxic chemicals? Do either of you care to answer that?
I can jump in and start for a little bit.
Sure.
Black Women for Wellness has a plastics report that is coming out, I believe April 1st, but it's coming out sometimes during April, depending on that graphic design situation going on. But plastics are, they're in the oil drilling and the oil extraction life cycle, right? So they produce the PFAS also, they produce the chemical compounds also. And it's not only plastics in like the plastic ware we use every day, the plastic in packaging, but also the plastics in our clothes and the synthetics in our clothes. It's the plastics that has to be refined and transported. So there's a long life cycle to plastics that is forever.
Yes, yes.
Forever chemicals, right? So that's how they have an impact in terms of the plastics in shower curtains and the cleaners and all of that stuff. So plastics are very, very much an important chemical element that we need to look at in our life, that
Right.
we're just now beginning to study and even look at their whole life cycle.
Sure, sure. Shakur, anything to add?
Yes, yeah, thank you, Janet. So as it mentioned, synthetic material like polyester are derived from petroleum. And therefore the plastic, which really mean BPA, production is linked to many ways to the oil and gas industry. The process of refining petroleum into polyester fiber releases toxic product into atmosphere surrounding us, the factory, and BPA is, of course, in many products. So while the BPA is commonly found in plastic product like bottled water, it's also used in synthetic material like
Right.
polyester to enhance the durability. BPA is commonly, we get exposed through ingestion, because like you mentioned, it's in a lot of food packages that we're working toward replacing those with safer product, and also is absorbed through our skin. And
Sure.
it has been seen also in receipt paper. So when you go to the store, receipt paper, most of the store still has BPA and BPS in it, which is another thing, not food packages, but we get exposed every day.
Food packages, and let's not forget the water bottles.
Yes,
Right?
that's right. That's
So
right.
we are overexposed to plastic, and it will absolutely take a cultural shift.
Absolutely.
Get away from that. I mean, if we think about when we go to grocery stores and we grab a plastic bag and put lemons or greens or whatever produce that we're purchasing, as opposed to a cloth bag
Yeah.
or a paper bag, right? So, and when we go out to eat, sometimes if it's takeaway, then we get plastic utensils and then the plastic container that it comes in.
Yeah.
Work to be done around plastics for sure.
For sure. This is a place where CH is actually working very proactively with businesses and schools, with governments and many other institutions to try to move this market away from these unhealthy products, right? Like it's specifically with single-use foodware, as you just mentioned, the production and consumption of this single-use material just creates this massive amount of avoidable waste. And of course, it depletes natural resources. So I think at the end, what I'm loving about this thread here is that we have to understand that this is actually both an environmental health issue that is actually a climate change issue, right? Because we are talking about petrochemicals. And so making that linkage is really important, especially at this time. And it's very actually unusual. Folks tend to think that there are people working on climate and energy, or they are working on environmental health. And in fact, they're so interrelated. And it's really critical that we combine those two things. Look, there's an additional question in the chat that I just want to pose and try to answer really quickly. We are coming up on time pretty soon, but it's essentially about alternatives, right? I know that we have talked about so many different kinds of products. This is the thing that makes us not the most thrilling guests, every time we're at Thanksgiving dinners. Trust me, guys, this is it. Everything is toxic and everything is trying to kill us. And this is why I don't get invited back. But the question about what are the alternatives to the chemicals in these products, and what are the solutions that we can ask these companies to do, right? Like to enact if they're willing to do so. And are these alternatives financially feasible? So that's essentially the spirit of the question. And I want to start by saying it's not just about the company itself, right? It is about our consumer choices. And this is one piece. So we're not just talking about plastics and avoiding that. We're talking about packaging and avoiding that, demanding less packaging. But we're also talking about, say, flame retardants. So someone else in one of the questions that talked about their couch or their mattresses, right? There are so many different products that are coated with certain chemicals that ultimately are harmful to our health. And so we do need to, as Janette mentioned earlier, try to get educated about requesting the things that have know this and know that and know the other, right? Ultimately, if an article of clothing says that dries fast or is non-stick or is moisture wicking, that's a function of a plasticizer. That is a function of a chemical that is coating the fibers of the fabric in order to give it that property. So I think that we also just have to be able to like navigate a little bit of that, and organizations like ours are here to help navigate this. And so please, please, please get in touch. We are at ceh.org, and we're going to share in a couple of slides, in a couple minutes, the sites for both our organization and also for Black Women for Wellness, because there are so many resources. My team is also going to be sending out some of the resources that we've talked about today.
Okay, so I want to jump in.
Please.
So I'm going to say, don't get yourself uninvited to dinner. Go to the family reunion, go to the holiday dinner, that type of thing, right? So because at this point in time, we absolutely need our family. We need that circle of protection and defense and love and joy. So, but I do know what you mean, right? Because I'm a vegetarian. And when I first started bringing vegetarian dishes to the family reunion, they were like, we'd rather have the peach cobbler than you. So come on with it, right? And this is why I want to say that one of the things we can do is start small, be incremental. You don't have to do a major shift in your life all at one time, because that's not sustainable. Right. So some of the things we can do, we talk about clothing, for example, right? I have so many clothes in my closet. How can I reuse those clothes or brighten up those clothes and stop buying so many clothes? Especially, I'm gonna call them single-use clothes, because they don't wash well and they don't hold up in the dry cleaner, which is one thing we can reduce doing too, going to the dry cleaners, right? So if or do a clothes exchange with your friends. I'm tired of this skirt. Maybe you like it, right? Maybe you even asked me for it a year or two ago, right? So that's one thing we can do in terms of reuse the clothes in our closet, right? Then we can look at one of the things that's happening is, even at our organizational level, we decided everybody would get reusable bamboo cutlery. Right? So as our organizations, we can start modeling that behavior, right? And instead of using plastic, use glass or bamboo or potato starch, those type of things. So if we start modeling that at an organizational level, then hopefully it can go into the home level also, type of thing. Now, I know one time we brought some glass takeaway containers, and yeah, I haven't seen them since, but there you go. Another thing is to be aware of is greenwashing.
Yeah.
Right? A lot of products now will have their label looking very healthy and clean and green with natural colors. You still have to read the label.
Yeah.
Because greenwashing is a real thing.
Thank you.
We can educate ourselves. Absolutely. But my main advice is start small and make it sustainable.
That's awesome. Thank you. That is a great ending for that. Shakura, anything to add? We are coming so close on time, but please note that we are sharing here the contact information for all three of our delightful speakers and their organizations. They're very hardworking. They are, of course, also aggressively pursuing and supporting the Global Plastics Treaty that's currently being negotiated at the UN. Which is around toxic transparency and petrochemicals. So our policy work continues, even as we are here advising you to figure out your bottled water use and also your cutlery and moisture wicking clothing. Shakura, anything to add?
Thank you, Kizzy. Great conversation. I enjoyed the town hall very much, and I hope everyone did as well.
Awesome.
Thank you for having me.
Of course, of course. Well, with all of that, thank you again to all of our speakers, and thank you to our audience for being here. And I don't take it lightly that your time is so valuable. I hope you found this helpful. Please get in touch with us. If you have questions, we will circulate the slides. And thank you for attending our event today. I really appreciate it. I hope everybody has a lovely rest of your day.